Can children get extrapulmonary TB, and what are its signs? Imagine a tiny bacteria that can travel beyond the lungs and affect other parts of a child's body. Yes, children can develop extrapulmonary tuberculosis, which means the infection spreads to organs outside the lungs. Children are actually more prone to this form of TB compared to adults, especially those under 4 years old, infants, or children with weakened immune systems. The bacteria, called Mycobacterium tuberculosis, can move from the lungs into the bloodstream or lymphatic system and settle in other organs. This spread can happen quickly in children, often within weeks or months after initial infection, unlike in adults where it might take years. When TB spreads beyond the lungs, it can target many areas like the kidneys, liver, lymph nodes, bones, joints, the lining around the brain and spinal cord, the heart muscle, the genitourinary system, and even the skin. Because the symptoms are often vague and develop slowly, diagnosing extrapulmonary TB in children can be tricky. Common signs include persistent fever, chills, night sweats, weight loss, loss of appetite, fatigue, and a general feeling of being unwell. These nonspecific symptoms can be mistaken for other illnesses, which sometimes delays diagnosis. The way extrapulmonary TB shows up depends on the child's age. Older children and teenagers often have symptoms similar to adults, like ongoing fatigue, weight loss, night sweats, and fevers. Children between 1 and 12 years old usually have a persistent fever that doesn't go away and unexplained weight loss. Infants are the most vulnerable and may show signs like failure to grow or gain weight, sluggishness, fussiness, vomiting, poor feeding, or a bulging soft spot on their head if the infection involves the fluid around the brain. If TB affects specific organs, the symptoms can be more targeted. For example, if it involves the lining around the brain, called the meninges, children may experience headaches, irritability, fever, vomiting, and changes in consciousness. When TB affects the fluid around the heart, symptoms include chest pain, difficulty breathing, swelling in the legs or abdomen, and a rapid heartbeat. In severe cases, miliary tuberculosis can occur, which involves widespread dissemination of bacteria throughout the body. This form causes high fever, chills, weakness, breathing problems, and can be life-threatening, especially in very young children. Diagnosing extrapulmonary TB in children often requires careful testing because symptoms are subtle and can mimic other illnesses. Doctors may need to take tissue samples or biopsies from affected organs to look for bacteria or granulomas, which are clusters of immune cells that form in response to infection. Laboratory tests, imaging studies, and clinical evaluation all play a role in confirming the diagnosis. Treatment for children with extrapulmonary TB involves a combination of antibiotics taken over at least 6 months. The usual drugs include isoniazid, rifampin, pyrazinamide, and ethambutol. Early detection and prompt treatment are crucial to prevent serious complications, such as permanent organ damage or long-term disability. In summary, yes, children can develop extrapulmonary tuberculosis, and it can affect many parts of their bodies. The signs can be subtle and vary depending on the affected organ and the child's age. If TB is suspected, it is essential to seek medical advice promptly. Healthcare professionals can perform the necessary tests and start appropriate treatment to help children recover fully. Always remember, early diagnosis and treatment are key to managing this disease effectively.